So I think that's actually a good segue to Brendan. And Brendan, I know you want to talk a little bit about the value prop around PPPs for digital health in particular, and some examples of successes and places where it might not have gone so well.
Yeah, great. People hear me? Is that working?
It doesn't sound like it. There's always something.
Testing. All right, there we go. Thanks, Jennifer, and thank you, Shupo, for the comments. VitalWave has been working in the digital health space, and I've been working in the digital health space with VitalWave for about 10 years now. And since the early days of digital health and mobile health, or mHealth as it's often called, it's just been kind of an article of faith that if you are ever going to get to long-term scale or financial sustainability, that you need the involvement of the private sector to do that. You can't be over-reliant on grant funding that runs out, and you need to be able to transition. And when you think about digital health, it's understandable why that would be a strong belief. You are talking about developing and launching and maintaining complex software and hardware solutions, and that's an area that goes well beyond the core competency of most ministries of health, or indeed many areas of government. Kate Wilson, who's the CEO of the Digital Impact Alliance at the UN Foundation, has often said, how many people at a health ministry have actually ever shipped software? The answer is probably none, but that's basically what you're talking about, and that's what you're expecting these folks to be able to do. So I really like this idea that a lot of times the conversation goes to funding, but that's often not what's needed. It's the technical capacity, the business know-how about how to launch and maintain software, in many cases in digital health. But for as much attention as there has been around this idea of private sector involvement in a large and sustained way, it's been really hard to get to a model for that works. And again, companies have been at this for a long time. We work with major foundations and development organizations like the World Bank, but we started off working solely with companies like Intel and Microsoft and Adobe. And over the 10 years that we've been working in digital health, we've worked with companies in the IT, in the pharma sector, and the telecom sector on their strategies for digital health. And in that time, we've seen many of them make forays into that space, even setting up digital health units, only to eventually fold them because they just could not figure out the business case for their long-term involvement and really make that case to their board and to their senior management. So it's really been a challenge. We've especially seen that in the mobile industry space. You have a lot of operators, and in fact, the GSMA, the Mobile Industry Association, had made several big launches into the mHealth space and ended up cutting back on them. And it's been hard for them to figure out. There was an assumption, I think, in the early days that that the operators were going to play a lead role in digital health services and solutions, and it hasn't really worked out that way. But you continue to see this huge demand. Actually, Supo mentioned yesterday the Digital Reach initiative in East Africa, and VitalWave is actually working with that initiative, with the EAC, on the development of their long-term strategy. And I just came back from a workshop in Tanzania with the representatives from the EAC on this topic, and there continues to be huge demand and huge ask around how do we engage the private sector here. We need to do this. We know we need to do it, not only for the financing, but also for the capacity issues that have come up. So I'm intrigued by the idea that PPPs could be playing a big role in digital health, but I think that when you're thinking about how to structure and where PPPs might actually be appropriate in digital health, I think it's important to think about the use cases where they could actually make sense as a mechanism. So just to kind of back up a little bit, when we talk about digital health, it's a bit of a catch-all term, and we're really talking about everything from national systems for collecting and aggregating and analyzing routine health indicators, all the way down to point-of-service solutions that are for monitoring patient health or diagnosing different conditions. So when thinking about funding models, we need to not think that there is a one-size-fits-all solution to any of them. And we and others in the digital health space have come up with different categories of use cases for digital health solutions. So an example of a use case would be the use of mobile phones for tracking the distribution of drugs in a mass drug administration campaign, say for a neglected tropical disease. When you think about that, who are the actors who have the incentives to participate in and pay for a solution like that? And here you can see that there's a pretty clear case that in addition to governments and donors, pharmaceutical companies might well have a strong interest in being a part of a solution like that because it might give them valuable data on how their supplies are being distributed. It might also allow them to track and manage counterfeits that are going out there and get on top of that problem. And so you might reasonably expect, and in fact you have seen, pharma companies participate in those types of digital health solutions. I think you also see that in telemedicine-oriented use cases where medical equipment manufacturers have a real incentive to participate in these types of solutions. And in fact, again, I think with the 6 counties initiative we've been hearing about and some of the others, companies like Philips and Huawei do have an incentive to participate in those. In other use cases, I just don't think that the PPP mechanism is going to play a huge role. And so when you think about those national level systems for collecting and aggregating data, you could see potential in the monetization of data where maybe private sector companies would be involved, but I think the incentives are a lot weaker. And so I think some of these build-outs of systems like DHIS2 in low and middle income countries, they are extremely expensive to roll out. Just getting the hardware out there, getting the connectivity to facilities, training people, maintaining the software, updating it over time. And I think we should be measured in our expectations about what sort of role the private sector might play in those types of use cases. So I think it's important to tease apart the use cases and think about which ones PPPs might really make sense for. I think the other thing to think about is just country context. We've been hearing during the last 2 days about countries like Nigeria and India and Kenya, and great examples of places where there's a lot happening in digital health and you're starting to see some scale. These are countries that also do have not only receptive environments in many cases to foreign multinational companies in health or pharmaceuticals, but have robust local private sectors. This point has been made a few times during the last few days that when we're talking about the private sector as a partner here, we should be talking at least as much about the local private sector and not entirely at all about multinational corporations. But when you look at other countries, VitalWave has done a lot of work over the years in Ethiopia. And Ethiopia has an impressive public government sector, a real ability to mobilize resources in the public health system and really empowered managers in many cases. The private sector is weak. It's very limited. There's a lot of state control over private entities. And there are other African countries as well that I think just don't have the sort of local private sector that would allow PPPs to take off in the same kind of way that we've seen in other countries. So I'm gonna stop my comments there. I have a few other things in the question and answer.
Yeah, thanks a lot, Brendan.